Hello, in this video we're going to talk about cellulitis and erysipelas, which are bacterial skin infections. Cellulitis is a bacterial skin infection of the dermis and the subcutaneous tissue. The normal presentation of cellulitis is an infection in the lower limb, such as near the tibia, for example. A good differential for cellulitis is another bacterial skin infection called erysipelas, which is actually known as superficial cellulitis because it is infection of the superficial dermal layer. So let's just learn about erysipelas first, but first of all, recap the anatomy of the skin. The skin anatomy, the skin layers, two main ones, epidermis and the dermis. Below the dermis is your subcutaneous tissue, also known as the hypodermis, which is what actually makes up your superficial fascia. Below the superficial fascia is the deep fascia, a layer of connective tissue which surrounds organs such as your muscle here. Erysipelas is an infection involving this area here, which is the superficial dermis. Again, it is a superficial dermal infection. The main causative agent is usually group A streptococcus, which is also known as strep pyogenes. It is essentially a cocci, a gram-positive cocci. The clinical presentation of erysipelas, classic one, is an example of a patient coming in with sort of a swelling, inflamed, butterfly-appearing rash, which is a good differential for systemic lupus erythematosus. Aside from this, the patient can present with systemic features such as fevers, chills, rigors, as well as lymphatic involvement. Erysipelas can also present in the lower limbs, such as around the tibia, for example. And it has the cardinal features of inflammation, which is very important. These are warmth, erythema, which is redness, tenderness, as well as swelling. So if we were to look at erysipelas again in this skin diagram, we can see that the whole skin area is markedly raised and it forms distinct borders. And this is because you have inflammation of the superficial dermis, which pushes everything up. And in this area, you also have your lymph vessels and its valves coming all the way up to the superficial dermis. And that is why you commonly get lymphatic involvement. Now that was erysipelas. Let's compare that to cellulitis. The classic presentation of cellulitis, as I mentioned, is in the lower limbs, such as around your tibia. And this is classically in patients with risk factors such as diabetes. The other common presentation is in children around the eye. This is called periorbital cellulitis. And like erysipelas, cellulitis has the cardinal features of inflammation. You have warmth, you have erythema, you have tenderness, and you have swelling. So let's take a closer look at cellulitis and see what happens in the skin itself. Cellulitis is bacterial infection involving the dermis, more specifically the deep dermis and the subcutaneous tissue. And because it is a more deeper infection, a deep dermal infection and subcutaneous tissue, the appearance of the skin is only a little bit of swelling, it's only slightly raised, and you have more of an indistinct border. Clinically, what you can do is, in the area of infection, you can use a marker and draw around it and date it. The next day, you can see whether the infection is getting worse, and this is also a good way to see if antibiotic treatment is working or not. The main causative agent of cellulitis is Staphylococcus species, such as Staph aureus, as well as beta hemolytic streptococci, such as group A streptococcus. Let's just now briefly look at the pathophysiology of both erysipelas and cellulitis. Basically, you have bacteria who possess virulent factors, such as, your exfoliative toxins and whatnot. And these virulent factors which will allow the bacteria to penetrate and invade the skin layers. At the same time, the patient have their own risk factors, which will increase their risks of developing cellulitis. And so both the bacteria factors and the patient's risk factors will allow for inflammation to take place in the dermis or the subcutaneous tissue area. So what are these patient risk factors I am talking about? Well, these risk factors include having a history of cellulitis, tinea pedis interdigitalis, which is basically a fungal infection in your between your toe webs, allowing basically access of bacteria into the dermis area. Also, if you have trauma, pre-existing skin conditions such as dermatitis also increases the risk. Other risk factors include lymphedema, obesity, diabetes, as well as venous insufficiency. Cellulitis and erysipelas can be difficult to distinguish. However, both are diagnosed clinically. Investigations that can be performed include culture of a wound foci. So a focus within the wound can be cultured. However, this is not often found. An X-ray of the area of the limb can also be done if you suspect complications such as osteomyelitis. Finally, you can also culture the tinea interdigitalis, and you can also perform blood cultures if you suspect sepsis and bacteremia. Also, if you suspect the patient has an abscess, a contained infection, you can order an ultrasound. The management of cellulitis and erysipelas is actually the same. Because the main causative organisms of both are gram-positive bacteria such as Staph aureus and group A Streptococcus, remember these guys, gram-positive bacteria, they have an outer thick peptidoglycan layer, and then they have a plasma membrane below it, and then inside the cell they have proteins such as ribosomes. Well, the management of erysipelas and cellulitis are antibiotics, first-line penicillins, such as dicloxacillin and flucloxacillin. The mechanism of action is that they inhibit cell wall synthesis, bacterial cell wall synthesis. If the patient is hypersensitive to penicillins, so they have some form of reaction, you can give cephalosporins, which are also beta-lactams and work the exact same way as penicillins. They inhibit cell wall synthesis of the bacteria. However, if the patient is anaphylactic to penicillins, you probably don't want to use another beta-lactam. And so an alternative is a drug such as clindamycin. Clindamycin works by inhibiting protein synthesis, and thus by disrupting protein synthesis, you essentially cause stasis of bacterial function. Complications of cellulitis and erysipelas are a lot. Some common ones include sepsis as well as chronic edema. Chronic edema occurs if you can imagine, if you have inflammation of the deeper skin layers, you're essentially increasing pressure and thus you don't allow the veins to return blood to the heart, and so it backflows, causing chronic edema. I hope you enjoyed this video on erysipelas and cellulitis. Thank you for watching.